Good evening. I'm Mayor Ron Nirenberg. We're County Judge Nelson. We're joined tonight by Dr. Anita Kurian from San Antonio Mental Health. This is our COVID-19 update for the San Antonio community. We're continuing to see great progress in our fight against COVID-19 and our warning indicators with the case rate down. Hospital trends are improving and positivity rate now has dropped to 3%. We're in a mild risk level for the second week in a row, and conditions are improving as we shared last week. So we're in a manageable state of this pandemic, which requires our continued vigilance. And with that, you can help us end this by getting vaccinated and encouraging others eligible to get vaccinated. So let's keep it up. We are definitely moving in the right direction, and we don't want to slip now. Today, we're reporting 131 new cases of COVID-19. 7-day moving average has also gone down to 364. Sadly, we do have 2 new deaths to report tonight, as well as several that are also awaiting investigation. So please remember who we have lost and keep their loved ones in your prayers this evening. There are 408 patients in area hospitals with COVID-19. Over the last 24 hours, there are 39 new admissions, 151 folks are in ICU, and 65 are on ventilators battling COVID-19. 83% of patients in area hospitals, again, to underscore this, 83% of patients in area hospitals are unvaccinated, despite the fact that the majority of our citizens now are vaccinated. Keep in mind, the vaccine will prevent severe illness and death. So get vaccinated if you can, and if you know someone who is eligible, encourage them to do so. 14 patients tonight in hospitals with COVID-19 are children. The hospital stress score remains high. I do want to remind you of the HEB gift card incentive program for those who have not yet received your second dose or your 1 dose of Johnson & Johnson COVID-19 vaccine. You are still eligible to receive a $100 HEB gift card. If you visit a Metro Health vaccine clinic, the incentive will be available as supplies last. I'll turn it over now to Judge Wolff.
Yeah, thanks. Yeah, we are headed in the right direction, but obviously the danger is not over yet. To give you one example, out at the infusion center we have out at the Bexar County grounds, one guy showed up in bad shape. He said he blacked out, ran right into our building and crunched it up a little bit. Over 6,500 people now have gone out to the infusion center to get the injections that takes about an hour to do. That hopefully prevents them from going into the hospital. An interesting part of that is that that's an expensive thing, about $2,100 for each person that comes out there, and almost every one of them are unvaccinated. But there's a pill coming out, Merrick, that we hope will get approval. I think they've asked the FDA approval maybe a few weeks before we know. But it's similar to what you'd be getting with an infusion that takes an hour or so to do it, and very expensive. You'd be able to buy some pills. You take quite a few of them, 40 pills within 24 hours. It's less effective than the infusion, but again, it'll be a lot less expensive. I don't know, anywhere from 1/3 to 1/2 of the cost. So that's sort of like the flu that you take. You have it 1 day less generally, and it stops you from getting the worst symptoms from flu. So it's similar to something like that. We require doctor's approval or prescription to get it. We're still doing vaccinations at one ball. We're averaging about 500 a day, which is too bad. I think since we started, about maybe 2 weeks ago, I guess now, we've done 10,000 vaccinations out there. So that booster shot that you get, I think, is helpful to you and will help us from getting sick and getting COVID and passing it on to someone else. So, again, encourage to the unvaccinated, please get vaccinated. You're a threat not only to yourself, you're a threat to your family, you're a threat to your children, you're a threat to everybody in the community.
Thank you, Judge. And holidays are right around the corner, so it's ever more important we get this behind us. Continue to do your part. Also, if you need to find a testing location or vaccine clinic near you, you can do so by going to covid19.sanantonio.gov. You can also call COVID-19 hotline by dialing 311 and hitting option 8. Keep in mind also, if you're struggling paying rent or mortgage, or you're without a job and loss of income because of COVID-19, we do have assistance programs available for you. You can also access those by calling 311. Please continue to do your part. We have made great progress against this Delta variant and getting the pandemic under control. Please continue to wear your mask, get vaccinated. Do it for you, do it for your family, and do it for San Antonio. With that, Dr. Kurian, myself, and the judge are available for questions.
Mayor, Judge, I wanted to ask you about the executive order that Governor Abbott had issued yesterday regarding no entity in Texas being able to mandate vaccines, and also it being put on the special session agenda. So I wanted to see your thought on the impact that order could have.
Well, I'll start, and would love the judge's perspective on that. The governor has clearly jumped the shark on COVID-19. This is absurd. We have an important job to do in protecting lives in our communities, and he's locked every tool in the tool shed that we need to do it. And consider this, voter demographic is he trying to appeal to by saying no one in Texas can protect you from COVID-19.
Can agree with the mayor more. He's trampling on the right of free enterprise. He's trampling on the right of a company to protect not only their employees but their customers. They certainly have a right to that. He's flying in the face of the president's executive order under OSHA that has right mandates for companies 100 employees or more under the Health and Occupation Safety to mandate vaccinations. It's a political statement that confuses everybody and provides no help for anybody. All the problems we've had with the state for trying to protect school children, to trying to protect everybody else, has made the pandemic worse in Texas than it really needed to be.
Do you feel like that it's hypocritical on his part, where last year he had said that businesses could enforce face mask mandates on the heels of the order that you put out, Judge Wolff, and now saying businesses can't mandate vaccines?
You know, he also said that they can't mandate masks either. He's done a completely U-turn from what he did for the first 2 or 3 months of the pandemic. I thought he had great leadership, but now he's turned it into political circus and has been to the will of, I guess, the right wing of the Republican Party, and is jeopardizing the lives of people all through Texas.
Well, and I'd also add that this is almost certainly going to be decided in the courts. And in the meantime, it's awfully embarrassing when some of the largest companies in Texas are very quickly declaring that they're going to ignore the governor. That leadership that we're seeing in the fight against COVID-19 with these kinds of political statements.
Are the city and county planning lawsuits of their own against this?
No, I don't think so. We've already got one pending. We're still, I guess, why it's really becoming, well, nowhere. EA did the right thing, then they did the wrong thing. So, but we still have our lawsuit pending. There's no final determination.
Dr. Kieran, do mental health officials think it's possible to prevent or at least greatly reduce the magnitude of winter spike if Bexar County can reach a certain percentage of vaccinated residents? And if so, what percentage would that be?
Absolutely. The only way we can put this pandemic in our rearview mirror is getting high enough vaccination coverage in our community. And CDC has not put out a threshold for herd immunity just yet, but it's been estimated by various experts across the nation that anywhere from 75 to 90% of the general population need to be vaccinated in order to get that herd immunity. And I just want to point out, in our community, about 63% of the general population are fully vaccinated, so we have a long way to go.
How important or unimportant is getting booster shots? Is there a goal for booster shots?
So from a public health standpoint, our focus is getting the unvaccinated vaccinated as soon as possible. CDC director has please said that getting a booster is a walk not a run situation. So there are folks who can benefit with booster shots. These are the 65 and older, 50 to 64 with underlying medical conditions, or 18 years and older who live in long-term care facilities. So if you do not fall in these three categories, please don't sprint ahead of your eligibility just yet to get boosters.
It seems likely that within a few weeks, Pfizer vaccines will be approved for children 5 to 11 years old. Could you discuss how the city and county will provide vaccines? Will school districts be involved?
So the FDA is scheduled to meet tentatively on October 29th to discuss the Pfizer vaccine eligibility for 5 to 12-year-olds. And we expect those vaccines, if all goes well, to be authorized by first week November. If that happens, our plan is to roll out vaccines like we've been rolling out the vaccines for other age groups. We will be offering the vaccines at the Amadome. We will be offering vaccines at all of our clinics. We are working closely with pediatricians because many parents feel comfortable taking their kids to the pediatricians. This particular age group is served well in the pediatrician's office. We're working closely with the school districts. So yes, we have various avenues to provide vaccines to this age group.
I think that's really important. I haven't seen the last week's total, but I know it's maybe it's been a week or 2 weeks ago. Over 154 school children have contacted, 54,000 school children have contacted COVID because of all the politics of the Attorney General and the governor refusing to allow mandatory safeguards in schools. The ones that have done that and have stood up to the governor, Northside Independent School District, I called Brian the other day, the superintendent congratulated them because they started early, the fastest requirement, kept it all the way through October, and they had a 1.8% infection rate, was much lower than other districts. So, he took that safeguard away, but thank goodness we have the district that stood up to the challenge.
Dr. Curry, has the CDC released any guidance to let y'all know how what the protocols will be for vaccinating children to 11? Will it be different than adults and children?
We expect it to be different, but I want to reserve my comments until the day organization comes into place.
Judge, I know you mentioned that there's one lawsuit kind of already pending. Is there any other action that the city and county will take against the new executive order from Governor Abbott?
Well, I would think that's a private sector issue. I'm not sure what individual companies will do. I think they're obligated to follow OSHA, and I think they're obligated to follow the president's directive, regardless of what the governor says.
You know whether District Attorney Joe Gonzalez will enforce Governor Abbott's executive order?
I seriously doubt it. I don't think he will. I hope not.
Mayor and Judge, have y'all been any more specific about what fines or penalties businesses or entities facing if they violate the governor's executive order?
I have not. I mean, as is pretty typical with these statements that the governor has released, it's pretty short on specifics and long on unintended consequences.
If the legislature really wants to protect the citizens of Texas, they'll take away those emergency powers that he has.
I mean, if there are penalties that come down, will the city and county provide support to local entities to help kind of offset any if there are fines or penalties?
Could you say that again, Zach? Sorry.
Will the city and county provide any support if there are fines or penalties that come from this executive order?
I think that would be a question for the attorneys. Not sure what stand we would have kind of date, but certainly the support we're provided to combat COVID-19. So public, as they have been, since we've gotten this under control, has full confidence to patronize local businesses here in San Antonio, we should do.
And finally, Mayor and Judges, in your opinion, do you feel like it's feasible for the state to try and go to court with every single person who may not choose to follow the governor's executive order?
There's, I don't know how many companies in the state of Texas. You'd have to file a hell of a lawsuits.
No.
That's all we have tonight. Thank you.